Okay, I'm sure that was enough time for others to join us. Okay, so we will be starting the webinar now. So first, my name is Alice, and I'm from the Student Recruitment Office at GBS Dubai. And I will be coordinating this webinar today on the topic how social media is revolutionizing health education and public awareness. First, let me welcome each and every one of you who has made out time to join us today for this webinar. So today we are honored to have an expert in this field, and she will be sharing with us invaluable insights on how social media can be used to transform health education and also to bring public awareness. So with over a decade in higher education, Dr. Iman Babika is currently a lecturer, a dedicated lecturer at GBS Dubai. She's teaching and handling the program healthcare management. So, Dr. Iman holds multiple degrees, including a PhD in healthcare management, and she is currently pursuing a second PhD in higher education leadership and also focusing on research in AI. So Dr. Iman is passionate about person-centered care, leadership, and operational management in healthcare, and is also integrated in healthcare management. She is actively she's actively participates in workshops and initiatives aimed at raising awareness and advancing holistic healthcare approaches. So without further ado, please make welcome Dr. Iman. Dr. Iman, thank you so much. The floor is all yours.
Thank you so much, Alice. It's really good to see you here. And I hope
Yes.
we have great time here together. Hello, everyone. Welcome to this webinar. I hope everyone is doing well. Welcome back again for the series of webinars that we already delivered during this year. Again, this is Dr. Iman, and I'm welcome you to my webinar, and I hope we have great time together. I'll try to be quick and light, let's say. I don't want it to look like we're having a very heavy webinar, so I'll start sharing my screen now. Suraj, from the control, please. I cannot share my screen. Can you change the role for me, please? I don't see the
Sure,
icon
sure,
for sharing. Thank you.
sure, sure. It's done. Can you just check it?
Minute, please. So I believe everyone can see the screen now.
Yes.
Yes.
All
Yes.
right
We can
then.
see.
All right then. So let's start. Today's session is a very, very lovely session, and I think most of you will enjoy it. First of all, not just as me as a health educator or healthcare management and health sciences educator, as myself very interested in social media. I know that a lot of people are interested also or having accounts. They are so active on social media. Either you are a user or a content creator. So that today we're going to speak how social media have what is the role of social media in revolutionizing health education and public awareness, especially now we are in the time of digital health and the digital time that we are in this era. Everyone is using social media and digital platforms. So starting with this session, I am going to give first a small introduction, and then I'm going to speak a little bit about social media. We're going to have some facts here about social media, about different platforms, which I know most of you know them and use them already. What is the power of social media in health education? And then we will discuss a very important topic that is the misinformation, the misleading information. I always like to include some case study, real case study with facts and numbers, and then at the end we're going to speak about how we can contribute to that in the awareness of health awareness and health education by using social media. And we're going to have a small conclusion at the end with some questions and answers. Well, I always like to start with a question that is, can you believe that a 60-second TikTok video can save a life? First of all, let me say that TikTok, because maybe some of you don't know about that, TikTok is one of the social media platforms. But can you believe that a 1 minute, 60 second, or sometimes less than 60 second can actually save a life? And I would always say in today's world, in this digital world, yes, absolutely 100%. A 60-second video or TikTok video, Instagram video, or any social media platform can actually save lives and actually can help a lot of people to prevent them from a serious critical cases. There's a lot of examples. We're going to go through them, but since I'm myself someone who's really active on social media as a user and a content creator, I see this a lot in my daily life. I go to TikTok, I go to Instagram, I use YouTube, I use LinkedIn as well because it's considered one of the social media. So we see a lot of these things, and short videos actually are really effective on how you are delivering a message to people. One of the examples that the 60-second videos can save life, literally, it is the CPR videos where you can people start teaching professionals. Now we'll talk about professionals, nurses, doctors, start teaching people how to perform a CPR and start literally saving life of strangers, either before the paramedics or before actually you seek for help, to call for help. And another example, which was really great at that time, the time of COVID-19, I think everyone so traumatized by that time, but there was a lot of awareness and a lot of campaigns happened at that time. I'm talking specifically on TikTok because if you remember, as I just mentioned, that TikTok have this small and short videos that is really effective when starting to getting the attention for the audience. So there was also a campaign about the FAST, which is a stroke awareness campaign that is from the American Stroke Association. And a lot of people actually were interacting and a lot of people were saved. There's a lot of cases and numbers were amazing and how it's actually saving a lot of people's life. FAST is actually is the acronym of FAST, F for fast face doping, that is giving the signs from the face, arm weakness, speech difficulty, and it is time to call for help or call the emergency. This actually saved a lot of lives, as I mentioned. And the good things about social media that you can deliver any kind of information in a nice, light, funny way. So if you can see here, this is actually a dance where people start teaching people how you can find these signs. And believe me, if you hear the music, it will stuck in your mind forever. You'll be doing this all over again. So there was a lot of videos and a lot of good actually content that you can find on social media that literally can save lives. And not just, I'm not just saying that, but these are actually facts by numbers, and there's a lot of publications and researches now that is actually approving and agreeing to my thoughts that literally social media can have the impact of saving a lot of people's lives, spreading more awareness, and preventing from the future maybe incidents as well. So starting with my main topic, this was just an introduction, starting with the main topic, social media in health education and public awareness. Let's define, first of all, what is social media. Social media is different kind of websites, it's digital applications that allow people to create, share, and exchange information in virtual communities and network. And this is, I think, as I mentioned, everyone knows about social media now. Like it's rarely to see or to find people that do not know about social media. This is the definition of social media. A lot of platforms are there that you can find yourself to whatever you like. This is now also it comes under your preference. What do you like? Which kind of social media that you use? There is Facebook, there is Instagram, TikTok, YouTube, LinkedIn, Twitter, I don't know if there is anything else I'm missing, but these are the platforms that I personally know and use, and there are so many more, of course. But mainly, I am going to speak about these main three platforms. Like you see them also in my examples, that these platforms are actually were growing and having the trend in the last couple of years. Speaking first about Instagram, Instagram has more of the visual images, pictures, short reels, and it helps actually in medical and health education because it have visual health tips shared on Instagram, creating a very nice, good infographic and short videos, or what we call them reels. I think everyone, if you have students here from Gen Z, they will say that reels, it's what actually attract them so much. The other platform which I have been an amazing revolution in social media, it's TikTok. TikTok has short, engaging health videos and health educational videos. There is a lot of trending videos and there is a lot of challenges, and you see people start to be more active on TikTok because of these trends and challenges. And it's actually a good and a perfect way for a quick advice. We do not have that patience sometimes to watch a 10 minutes or 15-minute advice. So a short advice from 1 or 2 minutes, that would be great idea to deliver a message, to share your opinion, and also to help people. The third platform, that is YouTube, and I think this is also something everyone can find it as a favorite platform. YouTube is giving the thing about YouTube have different length for their videos. It's mainly its videos, and it gives an in-depth health education through the videos, and this including some webinars, lives, it's a questions and answer sessions, and lectures, classes. So it can get even courses. You can attend an entire course in YouTube or in these kind of platforms. So different platforms in social media, different ways to enhance and empower health education and awareness. Let's go to facts, and I always like to refer to numbers and facts, and this is actually some of the facts about the social media use and how it was growing in the last
Uh,
maybe some years.
Hi, excuse me. I'm sorry, madam. I guess the slides are not moving.
The slides are not moving.
Yeah, now it's moving. Yeah.
And then I have to check it again. Hold on. Can you tell me that? Can you see the slides moving now?
No.
Okay, then I'm going to share it again.
Yeah.
Thank you for that. Just give me a second.
Yeah.
Sorry, guys. I think if I share the entire screen, that will be better. Is that okay? Suraj, can you just update me, please? So I apologize. My apology. Yeah. So I'll continue. I was just mentioning these. I hope that you saw this colorful slide before I stopped. So this is was I was talking about the different platforms, and then speaking about numbers and facts from 2017 to 2027. What are the facts and what are the numbers and how we can see the growth of social media in all over the world? As in, this is one of the latest reports that I found as in 2025. That will be since we are now in 2025. This report actually was published in the end of the last year, and it was telling us that this is how it's going to be. This is I apologize for this technical issue. Alice, can you see the PowerPoint? Can you see the
Yeah, I can see it
is it
now.
moving? Is it
Yeah, I
moving?
can see
Because
the
it
growing use
wasn't.
of social media.
Perfect, perfect. So I think we can go now. All right
Yeah.
then. So now, as we were talking about, I hope you saw my colorful screen again. The this slide that I already did, I shared with the different platforms. This is TikTok, Instagram, and YouTube. And then we're going to go for growing on social media. This is these are the numbers and these are the facts. So this is a report actually I found that was published lately and just predicting the numbers of users over the years from 2017 to 2027. So at 2025 till the day, we have 5.24 uh, billion of people that are using social media globally. So we can say 63% of people, or 64, like 63.9, 64% of people around the globe are using social media. Can you imagine that? That's a huge number. And it's actually where you can think about how we can use that and how we can benefit from that. By the 2027, that will definitely reach to the 6 billions and it's still growing. And then we are talking now a little bit about that growth. We said that this 63 billions, meaning that there's a lot of usage and that will be affecting the daily usage as well. So the users also for these kind of social media platforms, they have an average of 2 hours and 21 minutes. In some references also I found that it's 2 hours 24 minutes minimum average. So we're talking about average of every day that people are start using social media and for different reasons. Primarily they say they stay connected to friends and family, which is giving us meaning of more than 50% of people are staying connected through social media than the others. It's half of the globe. This is according to the American Psychological Association report from 2024. Another one here that is showing you which is the platforms that is actually having the more growth. And as I mentioned, some of the platforms are still growing, but you can see that on the top of them, Facebook always went. So Facebook was there at the top. Actually, I can say Facebook maybe was the oldest. That's why it's having more users. And so starting with Facebook, and then YouTube, Instagram, WhatsApp as well. I forgot to mention WhatsApp. It's one of the social media platforms, TikTok, and so on. So these are the growth, and this is the numbers, the facts that may let you just think for a minute how effective and how important social media when it comes to education and health awareness. Again, let's go back to these three different platforms and why that's important. These are very important because of the number of users are growing so much, and these are also another numbers that you can see that on TikTok. TikTok had also a majority of people who are using TikTok, more than 1 billion. They're using it daily, more than 1 billion. And TikTok actually mainly have the major hubs for health trend, as I mentioned, health content and lifestyle. You have also Instagram with more than 2 billion that uses for infographic and reels, 2.5 billion on YouTube for long educational content and health talks. Health content consumption on social media, who's consuming these and what are we doing about it. So if you look at the young adult engagement, that have 71% of young adults, we're talking about the age of 18 to 29, reporting that using social media as their primary source of health information. So you will see that we have 71% of the young adults that are relying mainly on social media to know or to learn about health information. TikTok Reach actually have videos that is over 50 billion views. And if you have a TikTok account, you can go to their official TikTok page and you can see the numbers that they are already posting from time to time. And the reports, they have more than 50 billions of views and a lot of users. And they always use the hashtags. If you see the hashtags, also it will give you the numbers of people who are actually use that hashtag. For example, we have hashtags that is related to our topic here about health, wellness, mental health, and so on. We have also on Instagram, it have a lot of popularity because Instagram have posts about health education and health awareness, which is over than 500 million posts, which gives a very good opportunity for everyone to reach out this information easily. WHO as well have an influence on social media. If you don't know, WHO have a social media page on all the platforms. They have accounts for their own platforms, and they actually publish a lot of facts, informations, awareness through their platforms in the social media. So WHO itself, the TikTok only, TikTok accounts have, until yesterday, I checked that, it's 4.3 million followers. This is actually demonstrating a global health engagement, which is coming from a very trustable resource, which is the WHO. The power of social media in health education. It is very powerful. I'm telling you, very, very powerful. Social media is powerful, as we mentioned, and I was just saying how powerful they are because the first reason would be that it's reaching for a global reach. We give all of these facts and numbers just to tell you how many people can be affected by social media and what kind of information can reach. It has a global reach, connects billions of people through these platforms like Facebook, TikTok, and Instagram. It's actually having a real time engagement. It's allowing people to communicate and engage in real time. This is through questions and answers, feedback, lives and live webinars, live sessions, which gives a very good discussions between the users and between the content creators. It has an amazing visual storytelling, and we all know that storytelling is the best way to educate. If you don't know, I'll tell you now. It's the best way to educate someone to tell them the information as in its story. It has a really great ideas when it comes to storytelling, and really good influencers would use that as an advantage because sharing health messages through storytelling, infographic, images, videos, all of these visual storytelling tools, it's the best for reaching out to people. It has a very good accessibility. It reaches a rural and urban and global audiences across devices and have different languages even in the translation or even in the captions as well for the subtitles. It have different options and different tools where you can adjust them for everyone's preferences. It have a personalized education. You can choose what you want and you can actually ignore what you don't want. It can deliver a tailored content specifically for groups. For example, maybe we want them for groups as in youth groups or for like maternal, for mothers as well. So you can choose that which kind of group that you are targeting with your education or with your aim for your educational purpose. So these are different reasons why social media in health education. Next is going to be how social media can enhance health education and public awareness. Several ways we can think about it. As we mentioned, it reaches a lot of people. Social media will reach millions and billions of people, and this will allow the health organization to disseminate the information, like WHO and what they're doing. It gives a real-time information, as we mentioned, that goes, if you think about it, go back to the time of COVID-19. It was the best way to reach people and have the best real-time engagement with them. It's enabling a timely, healthy update of risk factors, prevention, treatment, and awareness as well. And it could also provide an immediate access to reliable health resources. It's amazing when it comes to engagement and interaction. It's very good in having a very open interaction and communication between health professionals, health authorities, and the public. It's really good that you can have a feedback, a live session as well, that giving questions and answer for your concerns and for your grievances as well. Community building and peer supporting, online support of group of mental health, for example, different illness, cancer, also physical health and nutrition, Also, you can find a group of people that they can help you and support you if you're going through something. I know that there are a lot of groups now, a lot of pages that helps and support, let's say, autism, mothers with autism's sons or daughters. There is a group of cancer survivors, group of Alzheimer friendly groups or something like that. So there are some groups that will help for community building and peer support. Don't forget about the visual and interactive tools. It's really, really fun to see these visual interactive tools on social media when it comes to teaching or learning, learning a new information. The infographics and the short videos and the animations and the music as well and the background sounds and voices. We know we are more emotional, so we can connect to people through these things. This will help you to deliver the message or that kind of whatever education or awareness to people faster and easier. Now, we have another issue that it comes with the misleading information. So how can we deal with that? You know that social media is really good, but don't forget about the misinformation that is happening in social media, how we can combat that. We always say it's a double-edged sword, and we should be really, really careful when we deal with the informations in social media. So a lot of challenges that we may face will start with privacy concern, and this has been a problem globally all over the world. I don't know if you heard about the Facebook issues, the TikTok issue, that they have a concern about privacy, and the concern about privacy of the data of personal data, for example, or even the leakage or the breach of these informations when it comes to sharing them on social media. So the privacy concerns are always there, but it should be limited to actually have a better and direct impact. And there is a lot of ways now you can just be careful around what you are doing. First of all, when you are logging into any social media, you have to check all of the terms and conditions. Make sure that you read these terms and conditions, because at the end, you're the one who's giving the consent for that. Another one is going to be the misinformation. This is one of the huge challenges, the misinformation and the fake news. Significantly, this will impact public health. And I'm going to give you some examples here. Now you will understand what the misinformation can lead to, because it's just one tiny small video with the wrong information, and the widespread of disinformation, it goes really, really fast, especially if it goes to the explorer and the trend and it starts to reach the people. It may cause a humongous amount of misunderstanding and misleading for the information, and people may die because of this misinformation. Digital divide, which is going to be also a challenge because this affects few but has a minimal immediate impact because of the, as I mentioned, it's a digital work now. The problem also could be from the unverified advices. The problem would be from influencers or people who are talking with no experience, with no backgrounds, with no trusted resources that they are taking this information from. And unfortunately, in some cases, they are just starting to spreading these informations and words just in the sake of following a trend, or just wanting to be more, having more engagement with people, increasing the number of followers, more likes, more share, more comments. So in the sake of that, this could be considered very, very unethical when it comes to health and medical education. Another challenge will be the algorithm bias. The problem with algorithm bias that is you don't know how this algorithm can lead you to this kind of misinformation. If you watch a 1 minute video, let's say on TikTok, and that video, you don't know that the information is right or wrong, but you saw the entire video, and guess what? Social media actually start generating and start personalizing everything around this wrong information. You don't know about it, but the algorithm will start doing all the magic. And then you'll start getting all these misinformation and unfortunately wrong answers for your question because of the leading of the algorithm and how it's actually built to you for your own personal preference. Another thing will be the deepfake and AI generated content. And in this point, I want to say it could be also two way. It could be a challenging thing and it could be a good thing. AI is amazing. We're all using AI now. It's helping us a lot, but we have to be really, really careful. Using AI, only AI, just to create content on social media, especially medical and health content, can be very challenging. You have to go and find the real sources, making sure that these resources from a trusted authors, publications from a trusted resource, or from books or from journal, peer reviewed, and just making sure that you are having them in the right way. AI also can be a good way to create content, but again, we have to make sure that is accurate information. Information overload, also the information overload can be a simple issue, but has an impact as it is, as I just mentioned, you're just getting information from the algorithm here and there, more fake information here, wrong information from there, facts are not clarified, facts are missing. This could lead also to the information overload. We have also the sensationalism over the accuracy. Sometimes, as I mentioned again, we are more into a personal and emotional feelings when it comes to what we see. Sometimes I would see a baby crying, and then a different story was telling about that small scene, and I'll be really, really emotional when it comes to that, and then start to predict some things. And people will may think about it and take it more emotionally, and this will definitely start affecting on their life. Imagine that is you are seeing a tragic story on your phone, and then that will start affecting you, your mental health for the entire day or the entire week. And guess what? Even that story may be fake or it could be just a lie. So a lot of challenges we may face when it comes to the education and health education on social media. Again,
Uh,
this is an example.
Sorry to interrupt you, ma'am. Once again, I need to interrupt. The thing is, like, I think the slides again got stuck. Can you just reshare it once again? Some glitch it is.
Okay,
Yeah,
okay.
now it came. The challenges, right?
Yeah,
Yeah, now it.
but it's not moving, right? Hold on, let me check again. Can you see it moving now? Do you see the next slide with the lemon?
No.
Mm, no.
No. Okay, I'll share it again. How about now?
Yes. I
Okay,
can
can you see
see.
it
Yeah.
moving? Can you see it moving?
Yeah. The challenges. Back to the challenges slide now. Example of misinformation. Yep.
And the lemon now.
Yes.
Okay. All right then. Let's see an example. This is a really, really very good example that people will. It takes people to the misunderstanding and misinformation for from TikTok or from any kind of social media regarding health or health education. So we have, for example, here during the COVID-19, the pandemic time, people were bombarded with the updates, statistics, expert opinion across the platforms. And actually, at that time, people took advantage of that in both bad and bad, a good and bad way, and something that is called the infodemic, that is information from the pandemic. And this is actually it's a report from the WHO in 2020. They said, now can you imagine this? They said drinking hot lemon water can kill the COVID-19 virus in your throat. If you drink it daily, you won't get infected. And guess what? This may be I mean, a lot of people may find it's a real thing. It's like home remedy. We can do this, we can, but there is no single resource, a trusted resource that is actually saying that the lemon will definitely kill the COVID-19 and you will not get it anyway. So that was wrong, and the problem was like there's a lot of misinformation here. I went to the next slide, so I don't know if you guys see it. There is a lot of misinformation that comes here because first of all, there is no scientific evidence supporting that the lemon actually will kill the virus in your throat. There was no actually evidence for that. The second thing that the WHO and the Center of Disease Control they state that drinking warm liquid can soothe the sore throat. But that doesn't mean that will cure and kill or prevent COVID-19. Also, you can imagine that this claim falsely reassure people and may lead them to ignore the real prevention measurements that was given by WHO, such as the vaccination, mask wearing, and hand hygiene. So just a simple one myth, we can say, could lead to a lot of issues when it comes to people mind and understanding. If just a small, tiny one unsure fake resource, or like someone who came up with that, or maybe they twist the words like how we can see it here, it may soothe, but it will not kill COVID-19. And then you can imagine how things will escalate from that. Now let's see how what are the strategies that we can do, things that we can do to avoid this misinformation. And I always tell everyone, from my students, some people around me, since I'm an educator, so I have to tell everybody how to combat these kind of misinformation and how to prevent this misleading information. First of all, fact checking and reporting tools. Even for me, I am presenting to you a presentation, all of these resources I have. You have to make sure that you check the resources. And in every way, in every platform, make sure that you have the right resources. If you found an information on Facebook, TikTok, and there is, and now we have labels also on them. Some people we still keeping these labels and keeping these resources. Some that people will start removing them. You have to make sure that these are right and they're not fake and these are not misleading health content. Make sure that you are checking these and you have the right proper reporting tools. The second thing, use a verified account like WHO, account like NHS, accounts like here in the UAE, DHA, accounts like MOH, the Ministry of Health and Prevention. These are trusted, verified accounts. And you will see there's always a star next to that account. This means it's a verified from the from that platform authority themselves and from these organizations. This means that any information comes from them is genuine, true, and it is actually a right resource from the main resource. It's the right information from the main resource. Third thing could be by collaborating with health authorities. Social media now collaborating and have a lot of partnership with global health bodies, promoting accurate information, such like, as I just mentioned, WHO and a lot of hospitals and organizations are collaborating with social media platforms. Educational campaigns. There is a lot of campaigns now going on social media. You can be part of it as well, empowering the users to critically assess these content of these campaign. Like there is a campaign that is happening. It was happening in the last couple of years and it's still continuing till today. It's about think before you share. So whenever you start to click on that share button, you have to make sure that you actually think about it, check the resource, see it carefully, and make sure that it's appropriate and it's good and it's trusted to share. Because one share, just one share, can affect a lot of people and can actually have, I don't want to say it's a bad result, it could be for bad and good, but you have to think clearly and carefully before you click that share. So there's a lot of campaigns, as I mentioned, in social media, are very, very good campaigns. Campaigns like vaccine promotions. This is promoted by WHO and other health authorities. Mental health awareness. There is a lot of campaigns supporting mental health. First aid education, like CPR, as I just showed you in the beginning, CPR, first aid, disease prevention videos, and there's campaigns for free healthcare advices. You see healthcare professionals, doctors, nurses, educators like me are sharing healthcare advices for everyone. And this is actually, again, it helps the community and it helps to prevent and enhance and improve the health education for everyone. Some case studies that I found really, really interesting that I wanted to share it with you. And I'm going to give two examples for a good practice. And I'm going to give two examples maybe as a negative one. Let's start with the negative one. There was in 2020, it was the time of COVID, and I feel like everything happened at the time of COVID. there was a fatal consequences of this kind of misinformation on COVID-19. There was a study published in the American Journals of Tropical Medicine and Hygiene estimated that 800 people died and 5,800 were hospitalized due to what? Can you imagine? False information circulating on social media during the time of COVID. Many of these cases involve ingesting the methanol and alcohol-based cleaning products, mistakenly believing that it will cure the virus. So they were taking this orally, like drinking them or like eating them, and thinking that if you drink or had alcohol or methanol as a sanitizers, that will actually help you to prevent and cure the virus. 800 people died just because of the misinformation on social media. Another example, that influencers promoting unproven health tests. That's another issue as well. There's a study in the University of Sydney analyzed 982 social media posts from influencers promoting health tests like full body MRI scan and genetic testing. The research found that 87.1% of these posts emphasize benefits without discussing the potential harms, raising concern about overdiagnosing and unnecessary anxiety for people. So imagine someone is telling you you have to go and do full MRI, you have to do genetic testing because you may have this and this and this and that. And at the same time, it may not be necessary and there is no actual facts for that. That was a problem at that time. 87% is a big, big number actually for most of these influencers, just to say that because of their unproven health tests. There is also another example. Now let's take it on the bright side. We have the tweet to quit smoking. It was happening on Twitter, and this is what the name tweet to quit. It's a study funded by the National Institution of Health, exploring the effectiveness of Twitter-based intervention program. This is helping people to start quitting smoking. This study found that 40% of the participants on that using the tweet to quit maintained smoking cessation of 60 days compared of 20% using the traditional methods. And this will show you how effective that can be by giving this kind of campaign or awareness through Twitter. So 40% of them were actually was helpful for them. The next one is the Tawny skin cancer awareness. This has also happened in 2015. This is happened from a young woman from Kentucky that she shared a photo of her on Facebook showing several bruising of the skin cancer treatment. Her post actually, she gave a post that was a warning against the tanning bed, and it went viral, over 105,000 shared on social media, especially on Facebook. And there was a study published after that reporting that 162% of Google search was about skin and cancer, and 147% raised on the search about prevention or prevent this cancer or skin cancer, followed only her post. So only one post from one lady actually helped to increase the search of prevention and skin cancer, and this will definitely promoting a lot of health awareness related to a personal story or a personal experience of one person that can help a lot of people, and I'm pretty sure that will help to prevent and early detect skin cancer for a lot of people. Then we have the last thing, the essential digital media skills for public health carries. Like if you want to be public health or health educators, there's some skills that you may want to know about it, or you may start improving them if you feel like you need some kind of improvement in them. First of all, when you start to give some kind of content when it comes to health education, I always say, first of all, create your content and making sure that you have the right resources for your content. Make sure that you develop a very good content related to the topic or the stories that you are presenting, making sure that you have a trusted resource for that. I'll give an advice as well. Always put the source in your content. If you put in them on a video or if you are presenting them as an infograph and an image, always put either a link for the resource if you're doing an online resource, or you can put the resource as in the name of the resource next to your content when you are start publishing them. This also will help people to trust you more. You are you are trustworthy when you give me an information and I give you the resource for that. So this is the first thing when you start creating your content, and making sure that your content is engaging. And a lot of people will think, okay, I'll create something. It's only 5 people who viewed that. Okay, fine. First time, second time, third time. Let's start to work more on how to make it more engaging. Use storytelling. Use visuals. Use maybe some music, maybe they use the hashtags. Hashtags is amazing when it comes to social media and content creating. The second thing, as I mentioned, you have to make sure that you are engaged with the audience. Audience are emotional to kind of this kind of engagement. It's better for me to engage with someone, talk to them, communicate with them, ask a question and answer, get a feedback. I would prefer that rather than just reading a post. So try to make a sessions in between when you are doing different kind of social media content to engage with the audience, foster interaction, and build a community with them. You have to have a conscious community with them to build the trust as well between you. Analyze the data. Always use analytical to gain insight into your data and your resources. Your audience also would like to know where are you getting your resources and data from. You need to analyze your audience as well. You have to know who are you targeting. Are you doing campaigns? Are you doing sessions for specific groups? If you are doing them for children, for example, if you're doing them for mothers, for maternity, for example, if you're doing them for, is it mental health group, it's a specific group, which kind of audience or which kind of group you are targeting, you have to analyze that very well, analyze your data, analyze your audience as well. Also make sure that you know their behavior. For example, comes to and when it comes to, let's say, infographics, where are you now? Are you in the UAE? You know what kind of people who would be interested in your content. If you are in a different country, different age or different ethnicity, maybe different religion. So you have to also respect that. You have to make sure that you are having a content that is completely clear from all of the bias or the discrimination of people. Another thing, yeah, an important thing, you have to make sure that you are delivering an ethical, and I'll say it again, an ethical content. Make sure that you follow the ethics and follow you always have to align to the laws and the policies for your country or whatever region you are. Make sure that you are following the ethics and have the best ethical practices. Stay updated, always stay updated. And information that was published 10 years ago may be completely different than information that is published yesterday. So always stay updated, keep abreast of social media trends. Trends are really nice sometimes, and it's actually help you with engaging with more people. If there is a trend about, I think there was a trend about let's move. It is about physical activity where everyone just start dancing and exercising and having more physical activity daily. There was some challenges like that, and it actually attracts more people to watch and to see and engage with your content. Last thing, I want to give it like I would say a quick advice for everyone how you can contribute yourself in social media, health education and health awareness. I will talk about as you are a social media user, just a user who's just following some people, you're just checking your accounts here and there, or if you want to be, or if you are a content creator as well. If you are social media users, always share the credible information. You can repost. You know that as in you are a user, you can share, comment, repost, and I don't know what else. These are the things that you can do. When you repost and you are sharing, make sure that you verify these posts very well. Make sure you have the right information that you can share. So as I always say, just it's a one share away. You have to be really, really responsible. Make sure that you engage truthfully with people and with your content creators by comment, like, discuss, The posts, if you have opinion, share them, but you always have to have the right health behavior to promote health education. Again, you have to verify before sharing. Check from reliable sources before forwarding information and sending it to everybody, because anybody can be affected with the misinformation and misleading for the information. Report if there is any misinformation. There is a lot of ways now you can report misinformation and misleading on all different platforms. You can report for false or harmful health content as well. Support the positive campaign. If you see something positive and nice in campaigns, please support them. Join, promote for them, share, like, and comment, and participate in these campaign. You can also start posting yourself as a user and use some kind of hashtags to help to support these campaigns. On the other hand, if you are a content creator, or if you are thinking, or if you want to be a content creator, what can you do? First of all, I would always advise you. Again, I'm a content creator myself, so I'm going to advise you the same thing as I do. You have to be really, really accurate when you are sharing your information or whatever kind of resource that you are using. And in healthcare and in health education, we always, in every actually practice, we always prefer evidence-based practices. Make sure that these are from researchers and publications, at least from resources that you can trust, and they are evidence-based and up-to-date information. Be engaging. Use the storytelling, as I just mentioned. Storytelling is a very good way that you can reach people faster, easier. Use storytelling, visuals, and then images, and make sure that you have proper language when you talk to people, and a proper behavior as well. Be inclusive. Consider the cultural sensitivity and accessibility. I just mentioned that before. Again, you have to consider and respect the cultural sensitivity, the accessibility, the ethical considerations should be also taken very seriously. Be responsible, fact check before posting, use the credible resource, and make sure that you have the copyright. If you are taking them from somewhere else, please make sure that you mention that, and this is where you're referring your copyright to. Collaborate. You can also work with organizations like the NGOs, like you have peer review, you can have with the DHA, WHO. You can ask for collaboration with them, and they can actually help the collaboration. There is a lot of programs now that support content creators when it comes to health organization. Be consistent, post regularly, engage with your audience. Do not tell me I just posted today and I have 5 views and then I'll stop for the next year and then I'm going to post again. Social media does not work like that. If you want to be more active and if you want to be a successful content creator, you have to be consistent on the way you are engaging, how you are posting. Try to post every day. You have to be connected and closely to your audience, because these are the ones actually who will help with the success of your content. Last thing I want to say, call to action. You have to encourage the sharing and the discussion and the positive behavior change. And again, if there is anything that is needed to be reported, you have it and you can report it, and it's in your hand as well. So, in the conclusion, at the end, as a social media user, content creator, and for all of you who are using social media is a double-edged sword, and in health education, it can inform, inspire, connect, but there's always a however, but it can also mislead and divide. Let us all use this power wisely and spread the truth, break the stigma, and promote for well-being for everyone. Last thing, this is a takeaway for everyone. Every like, share, and post can influence someone's life. So that's why we say you have to be really, really careful before you hit anything. You don't have to be a doctor to save a life, but you may have the right information from trusted source, and you can share it with people. Use your platform, whether it's big platform, small platform, to spread the hope, knowledge, and the positive action. Let's make the digital world healthier, safer, and more informed place for everyone. So, answering my previous question, can a 60-second TikTok save a life? Yes, it can. together we can turn a 60-second TikTok video or reel of Instagram into a life saving moment. That's it for me for today. I hope you enjoyed the session and I apologize if I took a lot of time. And I would say going back to you,
Yeah,
Alice.
Dr. Iman, thank you so much for this exciting and thought-provoking session. It was
Thank
very
you.
informative, and it is astonishing when you think that just a 60-second video can really create a positive or negative influence in someone's life.
Absolutely. A
So,
60-second
guys,
literally can save or can kill a person. Literally,
yeah.
yes.
So, guys, please, we need to be careful. I'm sure all of us here have a social media. It could be a big handle or a small handle. Let's take caution on what we share, especially when it concerns health.
Okay.
And let's really be careful with the information that we spread to our families, friends, and to the society as a whole. Thank you so much again, Dr. Iman. That was really,
Thank
really
you.
informative. And
Thank you,
now we'll be
Alice.
moving on to the questions. Yeah, the very first question that I have here on my list is, how can digital storytelling and content creation help in building trust in public health messages, especially in areas with high skepticism?
Mm. It definitely will. It definitely helps. We saw the reports, we saw the numbers, we saw the growing how social media is growing fast. First of all, as
Mhm,
for today, I can't believe that anyone may not have access to phone or to a device or to
mhm,
internet. So you will
mhm,
see that billions are using devices now. Billions are using the internet. Wi-Fi is everywhere. Even in the areas, developing areas with limited resources, they still do have some
mhm,
kind of access to social media. And I think we can see this now. This is actually what connects us together. So if you think
yeah.
about it, how these are health organizations actually use social media as in the best and the fastest way to spread the awareness and to deliver their messages, aims, and objectives of health in the fastest and the best way. It definitely helps because, as we mentioned, I show the facts and the numbers. A lot of people
Mhm,
are using social media. A lot of people now are active. A lot of people are contributing to health education and awareness. It's affecting communities, not just on an individual as a person. It affects the family, it affects the community, and it affects the entire economy, by the way. So it definitely have a big impact, and it's definitely going to help to spread the good word about health and awareness.
yeah. All right. Thank you for that. And the next question is, what digital skills can one use? Or what digital skills do you think are essential for creating impactful and ethical health content online?
Okay. All right. So some skills you may need them. First of all, you have to know how to use your phone, how to use a device. All right.
Correct.
So
Yeah.
let's start there. You have to know how to use your device. Some skills I may ask you to start learning about them. Let's talk about the technical skills. At least you have to know how to shoot some videos, take some pictures. First of all, you may want to know some how you can do this digital designing for posts. You can use a lot of free websites and platforms now. They can help you
Mhm,
to create nice posts and videos. You can use AI, by the way. Using AI also could help you in a very, very good way to create beautiful content. These are some skills. And also, again, some skills that you may need, it's some research skills. And I know some people may find this a very big word to say do some research, but you have to
mhm,
look for information first before you start posting them and before you start talking about them. So even me, myself, all of my presentations, you find like small references here and there. So you have to search for the
mhm,
right content and for the right resources first, and then you start presenting to the people. Another skills that you may need to develop, that you may have a very good communication skill. So start
yeah,
because you have to engage with people. So you have to talk to them, you have to communicate with them, you have to respond to them, give them some feedback. They will ask you questions and respond. You have to know how to respond to people and engage with them with a very good communication. There is a lot of
mhm,
ways to learn how to communicate with people very well. So again, I will advise people to keep updated with all the resources and information. Keep updated with the different tools that you can use to create content for your social media, and make sure that you have the right message to deliver for the right people.
Okay. All right. We have a couple of questions. I'll just read three to four more.
Mhm.
And do you think social media should be regulated when it comes to health information?
Absolutely. Yes. It's the most reliable question. This should be regulated. And now we have the GDPR. This is where they can actually they help us a lot when it comes to the policies for the regulations, when it comes to sharing information, data breach, cybersecurity, all of that is there. We have laws and regulations here in the UAE, in Dubai, to maintain the best practice when it comes to the regulations on social media. Even for the users, that I always say you have to go and always check for the resources. That's why we said you have to check for the verified accounts, because it's definitely regulated by the law, policy, government, and the health authorities as well.
All right. And the next question here, what are some ways you can contribute to spreading accurate health information online?
Share, comment, what else? Share, comment, like. These are the three things. There are always people that do. But again,
Mhm.
before doing that, as a user or a content creator, think about what are you doing before you click on anything.
Mhm.
So if you are sharing a video, or if you're sharing a content, if you're sharing something with people, you have to make sure that you are sharing the right thing. You don't know how that will affect. Actually, you should be scared before you start sharing anything. So
Yeah.
make sure you can spread the word in the right way. Share, like, comment, and also use hashtags to support campaigns and health awareness and education.
Yeah. And I think we can also verify the information through trusted website like the WHO that you mentioned earlier, the NHS. So if you want to share any information, it's good that you go and refer back to these websites or social media platforms to see if it's something that is really encouraged.
Absolutely.
All
And I will
right.
say something about this. Actually, you may be with your friends and family and you heard some kind of information, a very weird one, like the lemon thing. So,
Yeah.
and when you ask them for the resource will be, oh, that was my grandma, or that was my aunt, and that was my friend. These are good resources for us, but come on, we need some research and facts
Yeah.
and numbers on that. Let's take
Exactly.
that, do some research, and then let's confirm grandma or family member information first.
Yeah. All right. So we are a bit running behind time. I thank you so much, Dr. Iman.
Thank you
Now
so
I
much.
will I will like to talk about GBS Dubai, and just give me a second. I will share my screen. Mm, that one. Okay. Okay, so GBS Dubai. Someone may ask, what is GBS Dubai? What does it stand for? So the acronym stands for Global Business Studies, and we are a member of the Global Education. We call it GEJU. Yeah, so GEJU is a group of colleges, education bodies that have come together and try to make education, seamless and more promising for students. So why Dubai is a great place to study and grow? There are so many reasons why you should consider studying in Dubai, and the very first one is your money goes further. Enjoy a lower cost of living, up to 30% cheaper than places like the US, UK, and Canada. So we all want to save. We all want to be able to save more, invest more. And Dubai is a place where you will get that opportunity. And yeah, it makes you feel at home wherever you are from. With over 90% expat, Dubai is a melting pot for cultures where everyone belongs. So in Dubai, when I first came to Dubai, I felt like I didn't need to go back home, because this is where you find all the nationalities, you learn different cultures, And yeah, it just gives you that sense of belonging. And the next point, be part of a growing future. So by 2027, the Dubai economy is expected to grow by 1.7 billion. So it means more opportunities. So this is another reason why you should consider studying in Dubai. English is widely spoken. So English is a second language, and it makes it easy for you to live, study, and work here. And opportunities for all. Dubai welcomes talents from around the world, offering equal chances to succeed, no matter where you're from. And yeah, GBS Dubai, like I said earlier, it stands for Global Business Studies. And we are a part of GEJU Global, offering globally recognized UK qualifications in the heart of the UAE. We are located at Dubai Knowledge Park, and is where it is the home for the city's international education hub. So here you will find a diverse, vibrant, and a more inclusive learning space. So why GBS Dubai? Why should you study with us? Should you study with GBS Dubai? Studying at GBS Dubai offers opportunity to immerse oneself in sector relevant courses, gain access to industry relevant education, and make potential networking connection. So, like the session we just had now with Dr. Iman, she's an expert and she has a lot of experience in this section. So, this is what we talk about, that you have sector relevant courses and experts who can actually relate to the industry cases. So, international recognition. GBS Dubai, our programs are internationally recognized. It's KGA approved. It's a Pearson certified qualification, and we are also a gold approved learner for the ACCA program. This is for students who want to practice as a chartered accountant or finance auditor in the bank or in the business environment. We have flexible study options, and our campus is in, like I said, is in the vibrant education hub of Dubai. And the pathways to a degree level, academic scholarship are also available. This is something that not most colleges do offer, but with us we do have academic scholarship that makes it more affordable for you to study. And career monitoring programs, we have, like I said, we have experts that are they are enriched with the industry knowledge, so they can actually be able to guide you in the programs that you want to study. We have exam free practical learning. This is something that is very exciting, especially for students. No student wants to be under that exam pressure where you feel like, oh, you need to pass. Here at GBS Dubai, it's more vocational studies, so yeah, you can be rest assured that you won't have that exam pressure. And yeah, we have affordable accommodation as well, and career and employability focus. So after your studies, what's next? Or even while you are studying, what's next for you? So we have a dedicated department for the career and or employability section. And some of the programs that we offer at GBS Dubai, we have on campus programs and we have online programs as well. So we have level two foundation programs as well, level two in international diploma in business. Level three, we have in IT and also in business. We have level four and five higher national diplomas. We call them HNDs. So you can have that in international business, healthcare management. In digital technologies, we have two specializations, which is AI and cybersecurity. And we also have HND in construction management. And we have the professional qualification, ACCA, the Association of Chartered Certified Accountants, like I mentioned earlier. So for the online programs, we have level three foundation, international business. This is diploma in business. It's a level three program, and level four and five HND international in business. And also we have the short course. This one is just for 4 weeks. It's a global investment banking analyst program. So our intakes is January, March, June, and September. And we also have an open week next week. Please feel free to walk into the campus anytime from 9 a.m. to 5 p.m. You can just walk directly to the admissions office, and a member of the team will be happy to assist you. Or better still, you can just log into the GBS website, fill in the form, send us your inquiry, and we will be happy to assist you further. And that brings us to an end to this exciting webinar. Dr. Iman, thank you again so much. And to all our attendees, thank you for
Thank you
making
so
our
much.
time to join us. It was really an exciting session for me. I hope you also had fun and you learned something new about social media. It's not just a place for you to go scroll and watch. You can actually watch a video and you can save a life just by watching a 60 minutes video. All right, guys. Thank you so much. It was a pleasure. And yeah, do have
Thank
a
you,
good
Alice.
day.
Thank you so much, and thank you for everyone who attended. Thank you for all the
Yeah,
audiences. Thank you for all the questions, and I hope to see you next time in the next webinar. Thank you. Goodbye.
definitely. Thank you. Have a good day,
Bye.
guys.
You
Bye.
too. Bye.